I think you're going to love this case. Incredibly, it's actually 3 separate cases. Over the course of 2 months, 3 middle-aged men came to a local emergency room, complaining of prolonged, non-specific fatigue and joint pain that had persisted for several weeks. Further history revealed another similarity. These men were all farmers who lived in local rural communities, and their diet consisted of meat, unfortified milk, and water. The patients all had normal vitals and a nearly normal physical examination. One of the patients did have severe gingivitis, but otherwise nothing else was out of the ordinary for any of them. Let's pause for a second. This one's hard because the findings are so limited. Can you guess the diagnosis anyways? Here's a hint. This condition has become rare in most of the world today, but was much more prevalent before the 20th century. It turns out these patients had scurvy. The consulting senior rheumatologist hadn't seen scurvy in nearly 30 years, and both the ER and junior rheumatologist physicians were unaware of the signs and symptoms of scurvy. In medical schools, it's often briefly mentioned on the same slide as beriberi, kwashiorkor, and rickets, all made rare by modern health practices. Scurvy initially presents as a general malaise, fatigue, and potential shortness of breath. But after a couple of months, more systemic symptoms begin to appear. Vitamin C deficiency affects the production of the body's most abundant protein, collagen. Collagen is what forms the gluey matrix that supports our tissues. Our cells use vitamin C in the construction of collagen's uniquely strong triple helix. Without these crosslinks, the protein is weak, and so are the tissues. Symptoms related to tissue weakening first appear in areas where new tissues are produced more frequently, like the mucous membranes in the mouth and throat. This is why the first physical symptoms of scurvy appear as oral symptoms, including significant gum inflammation characterized by the triangle shape of the gums between the teeth as seen here, as well as laryngitis and loose teeth. And since hair is also a fast-growing organ, patients will sometimes experience abnormal kinking as their hair grows, called corkscrew hair. For the same reasons, injuries heal more slowly, and fragile capillaries rupture more often, leading to bleeding in almost any tissue and causing symptoms like petechiae or bruising. Subperiosteal hemorrhages often occur, causing patients to lie still due to bone and muscle pain. You can see the subperiosteal hemorrhages on X-ray as a translucent white line elevated above the long bone, caused by the periosteum calcifying as the hemorrhage heals. Other hallmark symptoms of scurvy, particularly for children, is muscle and bone pain. As you know, collagen allows bone to be strong and elastic. Abnormally weak collagen proteins cause the osteoid matrix to calcify inappropriately. This looks like a dense, irregular, calcified line on the metaphysis, known as the Frenkel line. In this image, we can see the cortex is beginning to look like a pencil's tip, indicating that it's thinning, and that the bones are generally more translucent than usual because of osteopenia. Treatment for scurvy is pretty obvious: increased vitamin C intake in the diet. Bleeding and oral symptoms typically cease and begin healing within a few days of treatment, and patients usually recover fully within a couple of months. Now, let's take a look at this image from the same patient, taken 6 weeks after the patient began receiving treatment. You can see osteopenia has improved as the bones are less translucent. We hope you enjoyed this case. There are thousands more real-world medical cases on Figure 1, so don't forget to visit us and sign up so that you have access to the most valuable and interesting medical cases to help sharpen your clinical skills.